I'm here to answer this. Hello doctor, what causes PPH? Because this condition almost took my life within a blink of an eye. Now, we have four main causes of PPH. PPH, for those who do not know, is postpartum hemorrhage, that bleeding immediately after delivery, be it normal delivery or ACS. Now we have four causes of PPH. Number one, we memorize it as the four T's. The four T's. The first T is tissue. In case you have retained tissue in the uterus, what we were talking about the previous video. In case you have any tissue, any part of the placenta, any clots, anything, any tissue that has remained in your uterus, it will cause bleeding. So you have to make sure that you remove everything if that is the cause. Number two, among the four T's, the second T is tone. The tone of your uterus. There is something we call a tonic uterus, a uterus that does not contract naturally. Some of you have said that they have come across that, a uterus that refused to contract. Contraction is the uterus becoming like harder. It contracts and helps to expel some clots that might be have remained in the uterus. So if your uterus is atonic, that is it is so boggy, it is so soft, so boggy, it will not contract and it will not expel those clots, so you will continue bleeding. That is the second cause of the PPH. And one thing that is just natural to ensure that your uterus is contracting naturally, immediately after delivery, you will see your midwife, or maybe your midwife doing it or encouraging you to do it, rubbing your abdomen. You see, rubbing this way. You rub hard. There is normally a hard thing here, around here, so you rub it until it feels harder. Okay, then you make sure that you empty your urine. Make sure your bladder is not full, because even a full bladder will cause an atonic uterus. So ensure that you have emptied your urine, your bladder is empty, and then you rub the uterus so that it contracts. The third T is trauma. You might be having PPH not because of the clots, but maybe because either your uterus has some tears or lacerations you got when you are giving birth, or maybe the cervix has some tears, the vaginal walls have some tears that are causing that bleeding. So also that might be a cause of PPH. So we have to check whether your vaginal walls are intact and whether your cervix is very much intact, that it has no tears and it has no lacerations that are bleeding. So we have to ensure, in case you have a tear or a laceration that is big enough that is bleeding, we have to make sure that we suture it, because it might be the cause of your PPH. Now the fourth T is called the thrombin. Thrombin stands for, there are those people who normally, when you come to a hospital, even on admission, we take a blood sample of you and we do some tests. Among those tests, there is a test where we test how many, like how much platelets you do have. Platelets are some contents of the blood that help your body's blood system to clot. In case you have a cut somewhere, normally that bleeding normally might stop by its own. Maybe you press and it stops. Whatever causes that bleeding to stop are the platelets. They will cause some clotting of that blood and the bleeding will stop. So there are those of you who maybe due to too much bleeding during your delivery, the number of your platelets go low. So when it goes low, it means that your body system, even when you have those small lacerations, your body will just it will just be bleeding. Any laceration you have, it will just be bleeding. So still we check on that, to in case we find out that you have low platelets, we have to give you transfusion of whole blood, or some fresh frozen, we call them FFPs, fresh frozen platelets. Those are platelets, the main things that will cause the clotting of blood and prevention of that bleeding naturally by your bloodstream. So those are the 4 causes of PPH, and it's rare that it can occur all of them at the same time. So that's why you will find this mother has PPH, we have just sutured the tears and the PPH is over. But this other mother has PPH, we have to transfuse blood or transfuse those platelets. Then another mother somewhere has PPH, the only thing we are just doing is rubbing the uterus, giving some drugs to help contract the uterus, and removing the clots. It is because the management of that PPH will depend on the cause of that PPH. So we have to note the cause of your PPH and know how to manage it. I hope a Jack, is it a Jack or Martha? I hope you are contented with the answers now.